Good evening, everybody. This is Nurse Eunice with Florida Training Academy. And in tonight's video, we're going to do a review on knowing the role of the CNA. And as we do with almost every video, we'll give you about 10 seconds to receive those notifications and to join us in the chat. We'll be with you shortly. And Miss Nubian, I'm definitely praying for you. I know you have your exam tomorrow, so we're all sending you thoughts and prayers. And we know that you're going to do well because you've studied. And today, as a matter of fact, I received 3 different notifications from CNAs. One was from New York, one was from, I think, St. Petersburg, and I forget where the other was from. They all took their test and they passed also. So I know you all are going to do well. All right, let us begin, everybody. Good evening. Question number 1. Which of the following tasks is within the scope of a CNA's responsibilities? Is it A, administering insulin to a diabetic patient, B, assisting a patient with activities of daily living or ADLs, C, developing a patient's care plan, or D, performing wound care independently? Michelle, Chrissy, Martinez. Yes, Barb's. Great job, everybody. So this one is B. Assisting a patient with activities of daily living. CNAs can actually assist with that. And those ADLs are tasks such as bathing, dressing, and feeding. But administering medication, developing care plans, and or performing wound care are usually tasks reserved for the licensed nurse. Question number 2. Who is responsible for conducting the initial assessment of a patient? Is it the CNA? Is it a registered nurse or RN? Is it the licensed practical nurse or LPN? Or is it D, both the CNA and RN conduct the initial assessment? Hey, Yoli from Pensacola. Oh my God, the storm's coming your way also. So, everybody, please keep us Floridians, Georgians in your prayers because there's a storm out there that is the size of Florida. So, we can usually manage a lot, but this storm has just been sitting out there. And I think the last check, it was a category 4. So that's why I'm getting on tonight because I'm not sure if I'm going to be back on for the rest of the week if we lose power. So I'll definitely be praying for you as you all pray for us. And so question number 2, if you chose B, RN, you got it. So the initial assessment of a patient is performed by a registered nurse. So even though it may be the CNA and the registered nurse who go into the room simultaneously, the CNA will be doing the vital signs, but the nurse will be doing that assessment. Let's see what we have for question number 3. Question number 3. A CNA observes a change in a patient's condition. What should the CNA do? A, document the change in the patient's chart. B, reassess the patient later. C, perform an independent intervention. Or D, notify the nurse immediately. And that's easy. I think we've pretty much asked any question that could be on the CNA exam at this point. So yes, everybody, great job, team. You're going to notify the nurse. I know how tempting it is to be like, oh, my patient's in distress. Let's try to handle it. But no, the CNAs are responsible for observing and reporting the changes. And then the nurse will assess the situation and determine the appropriate intervention. Question number 4. Which of the following task is beyond the scope of a CNA's role? Is it A, taking vital signs, B, assisting with feeding, C, administering oxygen therapy, or D, helping with patient ambulation? Yes, which one is beyond your scope of practice? When you're taking this test, I know what you've seen in the hospitals. I know what you've seen in a nursing home. That's not always done correctly. So I need for you to be thinking about the state's requirements and the delegation. What tasks will a CNA perform versus the task that a nurse would perform? Which requires more skill, more thought, and more training? So if you chose C, administering oxygen, you are correct. So administering oxygen therapy requires specific training and is typically the responsibility of a nurse or a respiratory therapist. CNAs can assist with basic tasks, as we already stated, such as taking vital signs. So, what can a CNA do in relation to oxygen? So, if the oxygen has disconnected, if the line is disconnected from the device, you can reconnect it, but at no point can you change the flow of the oxygen because that means that you're giving medication, and a CNA does not give medication. Question 5. When a patient complains of pain, what should the CNA do after notifying the nurse? All right, so you've called me. What are you going to do while you're waiting for me to come? Is it A, administer pain medication, B, provide comfort measures, C, ignore the complaint unless it is severe, D, tell the patient to wait until the next scheduled medication time? I see you, Kalata, Fatima, Carrie, Chrissy, Corridor, Rochelle, Ugochi, Martinez. Oh, it's a lot of you all. His Glory, Miss Nubian, Yoli. Oh, it's a lot of you all. I thank you all for being here. And if you chose B, you knew that was right. So you're going to provide comfort measures. So after notifying the nurse, the CNA should focus on providing comfort measures to help alleviate the patient's pain while waiting for further instructions from the nurse. And comfort measures may include repositioning, applying cold or warm compresses, or offering additional support. Don't forget, you can do things such as elevation. You can elevate an extremity if someone's complaining of arm or leg pain. If they're complaining of a headache, you could dim the lights, maybe change the environment, maybe put on music instead of having them watch the TV. So there are non-pharmacological ways that a CNA can help a patient who's experiencing pain. Question number 6, which of the following activities is a CNA allowed to perform? Can you administer IV fluids? Can you give a patient medical advice? Can you change a patient's bed linens? Can you interpret lab results for a patient? You know those patients love you all. They love you so much. They like you more than they like the nurses. They see you more often most of the time. So they be like, hey, I got these lab results. Would you tell me what they mean? And your response should be, above my pay grade. So answer for number 6 is going to be C. What you can do is you can change the patient's bed linens. So CNAs are responsible again for those basic tasks and administering IV fluids, giving prescriptions, giving medical advice, and or interpreting labs are beyond your scope of practice. Even if you are in nursing school, you have to defer to the nurse. Question number 7. A CNA is asked to assist with a sterile dressing change. What is the correct action? Let's read this one carefully. A, perform the dressing change independently. B, refuse to assist because it's not within the scope of practice. C, assist the nurse by providing necessary supplies. Or D, perform the dressing change with supervision. Yes, Chrissy, Rochelle, Barb's, Geraldine, Michelle, that is right. So back when I started nursing way back in the day, 1999, the CNAs were doing a whole bunch of stuff they shouldn't have been doing. They were doing the wound care. They were starting IVs. Patients had phlebitis. The nurse didn't know what the wound looked like because the CNA was the one in there doing the wound care. According to state standards, a CNA does not perform sterile technique, which means you cannot perform sterile wound care. Once you're in the hospital, they change your name and they change your title. Once you're in the hospital, they will refer to you as a patient care tech. And if they require you to insert catheters or do anything in addition, that is when you will be trained to do so. But as a CNA with no additional training, you've not been taught how to do sterile gloves. Therefore, you cannot do sterile dressings or sterile wounds. But what you can do is you can assist me, the nurse, by going to get the supplies and just being there to help maybe hold the patient and calm the patient. So that's what you would do. And that's why C is the correct response for that particular question. Question 8, how should a CNA respond if a patient asks about their medical diagnosis? A, explain the diagnosis to the best of their ability. B, refer the patient to the nurse. C, look up the diagnosis in the patient's chart. Or D, avoid answering the question. I know it's tempting. You want to help the patient, but I want to tell you why. You just don't give them the diagnosis because some of the patients will, let's say that there was a lab order or a chest x-ray order because the patient had been coughing a lot. But in the chest x-ray, they found a malignancy. They found a mass. And now my very helpful CNA goes in and like, oh yeah, they found a mass on your chest x-ray, and the patient's going to be like, well, what now? What do we do now? So there are things that you shouldn't say as a CNA because you don't know the rest of the care plan. What you're going to do is you're going to defer to the nurse. Even if you know the answer, you're going to make sure that the nurse speaks to the patient. So a CNA should refer any question regarding the patient's medical diagnosis to a nurse who is qualified to provide that information. Because remember, it's just not telling this person what their chest x-ray result is, it's telling them what the next plan of care is now that we see something that may be abnormal. Question 9, who is responsible for creating a patient's care plan? Is it the CNA, the LPN, the physician, or the registered nurse? So Richard, we usually don't refer directly to the charge nurse. There's going to be a chain of command. So there will be a nurse who is assigned to your patients, and that is your immediate person that you're working with. And now if she or he can't help you, that is when you will go up the ladder to the charge nurse or to the director of nursing. But you want to go to the nurse who you're actually partnered with first. So yes, it's going to be registered nurse. The RN creates the plan of care. It is their responsibility. And then the LPN and the CNA, they add their input. For example, if we say that someone has ineffective airway clearance and we have them use that spirometer, the incentive spirometer, every time you go into the room, you're going to remind them to use it. But it was that RN who gave the initial teaching, the initial instruction, and she also started that plan of care for that patient. Question number 10, if a CNA notices that a patient's buttocks is red and irritated, what should they do? Is it A, apply a topical ointment, B, apply protective cream or butt paste, C, document it and continue with care, D, notify the nurse? I couldn't trick not one of you all. Everybody got the right answer. Oh man, you are some great caregivers. I am so proud of you because I just knew that one of you at least was going to say apply the protective cream. So I couldn't trick any of you. The best response for this one, anytime you see a change in a patient's skin, you're going to notify the nurse because that could be signs of skin irritation or breakdown. And as a reminder, your patients who are brown like me, we don't turn red. So redness is not a sign of a pressure sore on somebody who's African American or dark skin Hispanic or dark skin Asian. You're going to look for maybe a coloration change. It may be pale. It could be tender. So if their backside or their heels are tender, not necessarily red, or if they're pale, that could be a sign of lessening of circulation. And you want to notify your nurse of that also. All right, so question 11, what is the primary role of a CNA in a healthcare setting? You all are the backbone of healthcare. So what is your role? Is it A, provide direct patient care under the supervision of a nurse, B, diagnose and treat medical conditions, C, administer medications, or D, develop care plans? I've already given you this answer, so I know you know this. That is right. It is A. Miss Nubian, how confident are you feeling? You have a test tomorrow. Are you feeling okay so far? All right, so A is the correct response. Question number 12. Which of the following tasks is the nurse, not the CNA, responsible for? Is it A, measuring a patient's urine output? B, administering a blood transfusion? C, helping a patient with oral hygiene? Or D, repositioning a patient in bed? Because my CNAs try to do everything, but I don't want you doing something that's going to get you in trouble. So, which of these is a task for the nurse? That is correct. It would be administering a blood transfusion or the blood product. So, what does a CNA do while a patient's receiving a transfusion? You do the vital signs. You go check on the other patients while the nurse is in the room with the patient who's receiving a blood transfusion, because that nurse may not be able to leave for a little bit while she's monitoring for a transfusion reaction, hoping that the patient doesn't have one. So you can assist with the other task and take care of the other patients while that nurse is tied up. Question 13. If a patient refuses a bath, what should you do? A, force the patient to take the bath. B, skip the bath and move on to the next task. C, respect the patient's wishes and notify the nurse. D, document the refusal and take no further action. And your patients, they don't like being cold, so they don't want to take a bath. They don't want to get out that gown. So they're telling you no. You need to try to convince them to do so. But if they still say no, what are you going to do? And I see this one, we have some B's, we have some C's, we have some D's. So for this one, it's a little bit tricky. But if it's a response that does not include notifying the nurse, it is not the correct response. Because yes, we want to respect that patient's wishes, but we also need to notify the nurse that that task remains undone. So CNA should respect the patient's autonomy and report the refusal to the nurse, who can assess the situation and address the patient's concerns. Don't forget to document the patient's refusal. So this is an example of something that happens whenever you're giving someone a bath, or you're, helping them, assisting them with their care. It's not because they may have soiled their gown or they could have urinated on themselves. It's because we need to do a skin assessment. So if you don't go in and assist with that bath, if you can't get it done and the nurse also can't get it accomplished, we need to make sure that's documented, because when the daughter comes in at 7 p.m., she can say, well, no one offered me a bath. So it needs to be documented. But when you document it, also document that you notified the nurse. That way it's on me. And now I can go in and try to convince that patient to get that bath, and or make sure that it's documented properly that, we didn't do a thorough skin assessment because the patient would not allow us to undress her. Question 14. What is the correct response if a CNA notices that a patient has fallen? Is it A, help the patient up and reassure them? B, document the fall and continue with the other duties? C, leave the patient to get the nurse? Or D, call for help and stay with the patient until the nurse arrives? I only tricked one person so far. Yep, you do not help them up, you all. If they have fallen, you as the CNA do not by yourself assist them up. You have to do D. You're going to unfortunately have to remain with that patient. You cannot leave because the patient may go into cardiac arrest. So you're going to call for the nurse while you're there with the patient and reassure the patient who is still on the floor that help is coming. And don't forget that when there's an emergency, you don't use that handheld. You don't use the call bell button if there's an emergency. You either pull the cord that's in the bathroom, or you press the panic button that's in the room, and that alerts the whole hall. And if those are not working, because I have heard of a time where that device wasn't working, you're still in the room with that patient, stick your head out that door and start screaming help as loud as you can so that you can get another healthcare professional's attention. Even if that person isn't the nurse, if you're screaming help, they can go and get the nurse for you. But you cannot leave that patient. Question 15. Which of the following is the responsibility of the nurse, not the CNA? Is it A, reporting changes in a patient's condition? B, performing a head-to-toe assessment? C, assisting a patient with dressing? Or D, taking a patient's temperature? You're going to be nurses soon. You need to know which is which. So right now you're taking a CNA test, and then after that you'll be taking your NCLEX PN if you're going to LPN school, and then you can bridge over and take your NCLEX RN. So what role would the nurse do and not the CNA? And you're right, it's that head-to-toe assessment. It is B as in boy. Question number 16. If a CNA is unsure of how to perform a task, what do? Is it A, attempt the task and see how it goes? B, ask another CNA for help? C, notify the nurse and ask for guidance? Or D, skip the task and report it later? I see B's, I see C's, I see D's. Oh, looks like C's are winning. So I know it's frustrating to have to let the nurse know everything. But whenever you're hired, they're going to give you a checklist, and it's going to be skills that have to be performed under the supervision of a nurse. So I know how tempting it is to, well, I'm getting on this nurse's nerves. I don't want to keep bothering this nurse. I know it's tempting to think that way, but the nurse is responsible for making sure you're trained properly. So if you don't know how to do something, you don't go ask another CNA. Technically, you're supposed to do C. You're supposed to notify that nurse so we can make sure you're trained the right way. The nurse will teach you, and once she teaches you, then you're free to do it on your own. Question 17, which of the following is within the CNA scope of practice? Is it A, initiating a care plan for a new patient? B, perform a range of motion exercises with a patient? C, diagnosing a patient with a pressure ulcer? Or D, administering medications during meals? No one should get this wrong. That is right, Julie and Chrissy and Geraldine and Ugochi. Lynn, you're right. It is going to be B. You can perform range of motion exercises. Speaking of which, if you need help with your clinical skills, we have a whole playlist with clinical skills, and then we'll be producing more videos shortly. So hopefully within the next month, we'll redo all of our CNA videos all over again. And plus on my other channel, which is youtube.com/Eunice Mathis, we are now doing the NCLEX prep videos. So we're here from start to finish. We want to make sure that you not only start your nursing career right as a CNA, but as you work your way up, that we're here to guide you too. Question 18, what should a CNA do if a patient asks them to adjust their oxygen flow rate? Your patients are so cute. They're telling you, I can't feel my oxygen, turn it up. What do? A, adjust it as requested. B, increase the oxygen flow rate and wait for the nurse. C, ignore the request. Or D, explain that you cannot do it and notify the nurse. Yes, everybody. Hold up. The comments are coming so fast. I missed the comment. I'm so proud of you, Mary Bell. Congratulations. And someone I think said they're taking their philosophy examination. So I'm proud of all of you all. Just the comments are moving fast and I couldn't read them. So yes, you're going to have to tell little old Miss Eunice that no, Miss Eunice, I'm going to stand here with you if you're short of breath. I can sit you up. I can raise the head of your bed. But what I can't do is I cannot increase the rate of your oxygen. That is a nursing duty and or a respiratory therapist duty. Your job is to get that nurse in there. Question 19, when a patient is being discharged, who is responsible for providing the discharge instructions? Is it the CNA, the RN, the LPN, or the CNA and RN together? All right, so we got the patient, we got the wheelchair, they're happy to go home. Who gives them their discharge instructions? It is not the CNA. So it is the registered nurse. The response is going to be B. They have to do the initial teaching and they also do the discharge teaching. Question 20. Let's see this one. What is an appropriate situation for a CNA to report to an LPN versus reporting to an RN? Is it A, patient with an abnormal heart rhythm? B, a patient with a below the knee amputation who is requesting assistance to the bathroom? C, a sudden change in a patient's level of consciousness? Or D, a patient experiencing chest pain? So if you have a team that consists of a CNA, an LPN, and an RN, what would you report to the LPN? Oh, the answers are slow this time. I know, but so many of you all got it right. It is B. Great job, team. So, the different roles, let's discuss this. So, a patient with a below the knee amputation, that means when they get up to go to the bathroom, especially if they don't have a prosthesis, they're going to be they're going to need more assistance than just you by yourself. So if you're just standing them, turning them, pivoting them, and putting them in a wheelchair and then pushing them to the bathroom, that's different. But if this patient's trying to, maneuver to the bathroom bedside commode, you want to get help. And the best person to call to assist you for this particular situation would be the LPN. The RN would take care of those more critical or urgent situations, like somebody who has an abnormal heart rhythm. Maybe they feel dizzy or they're having palpitations, someone who has a sudden change in consciousness or chest pain. And if you don't know the differences between the two, the RN can actually push direct medication. So she has a syringe, it has the medication, she can push it directly in the IV. A lot of the LPN programs don't even cover IVs. So if there is something critical where you think this patient may need urgent medication, always think RN. If it's non-critical wound care that are medications, maybe like pills or enemas, you want to be thinking about the LPN. Question 21. A CNA notices a patient's intravenous or IV site is red and swollen. What should the CNA do? Is it A, stop the infusion, B, notify the nurse immediately, C, apply a cold compress, D, document it and move on? D's just heartless. I know none of you all would do that. So, yes, it is B. Notify the nurse immediately. Even though it may be tempting to stop that infusion, don't do it. That is the nurse's job. I'm so proud of you all. Question number 22. Which of the following tasks is outside of the CNA scope of practice? Is it A, assisting with toileting, B, performing oral care, C, administering oral medications, or D, observing and reporting skin changes? And I think at this point, you all really understand the role of the CNA because you are barely missing any of these. You're getting them all right. So, yes, what a CNA cannot do is administer oral medications. And I know what you're thinking. No, Nurse Eunice, you are wrong because my friend, she works at a nursing home and she gives medications. That's a CNA who has taken additional classes, maybe like a med tech class. When you're taking your CNA test, do not assume that a CNA has taken a med tech class. When you're taking your CNA examination, this is a basic CNA who doesn't have any additional training. They cannot do sterile dressings, they cannot give medications, but we know in the real world they can get that additional training. And here in the state of Florida, a CNA with 1 year of experience who takes the medication course can give medication. So, but during your test, the answer is always no. A CNA cannot give meds. Question 23. Which of the following should a CNA report directly to an RN rather than an LPN? Yes, you're absolutely right, Miss Nubian. Is it a patient with a minor skin tear, B, a patient experiencing shortness of breath, C, a patient needing assistance with dressing, or D, a patient requesting a snack? Yes, 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 you all have it. All right, that is a medical emergency. So the correct response is B. Shortness of breath can be a sign of a serious medical issue and should be reported to the RN as they are trained to assess and manage critical conditions. Minor issues like skin tears or assistance with ADLs can be reported to an LPN. Question 24. What should a CNA do if they accidentally make an error while providing care? Is it A, ignore it and hope it doesn't cause any issues? Is it B, report the error to the nurse immediately? C, correct the error without telling anyone? Or D, wait until the end of the shift to report it? Always think patient safety. Even though you made a mistake, what is safest for that patient? And yes, it is B as in boy. You all, we're not trying to get you in trouble. We understand mistakes happen. Report the error to the nurse immediately because that way we could correct it. Maybe, okay, so what would be an error? You gave orange juice to somebody who's a diabetic and their sugars were high. It could be something as simple as that. It's like, oh my God, I gave the wrong person the orange juice. Or let's say you forgot to get the blood sugar. Or something else is once you learn about diets, you're not supposed to give things with potassium to someone who has kidney failure or who's on dialysis. So here it is, you're thinking you're doing a big favor by giving this patient prune juice because they complain of constipation. But prune juice has potassium in it. And if someone requires dialysis, if their kidneys fail, their body doesn't excrete that excess potassium. So you can make their heart go into an abnormal rhythm just by simply giving them prune juice to help with their constipation. So things like that, if you notice it, you may think, oh no, it's not a biggie, but just go ahead and tell the nurse so that we can be aware and that we can monitor that patient more closely. Question 25. Who is responsible for supervising the work of a CNA? Is it A, another CNA, B, the CNA performing the work, C, a physician, or D, the registered nurse? So who supervises your work? All right, so I am so happy that everybody said D. That is really important because especially once you have more experience, you sometimes feel as if nurses are picking on you. But at the end of the day, if something goes wrong with that patient, and whether you caused a mistake, the pharmacist sent up the wrong medication, or the doctor wrote the prescription or the order for the wrong medication, at the end of the day, all that falls back on the RN. So the RN is not trying to be mean to you when she's asking you questions because ultimately she is responsible for the overall care of that patient. And if one person makes a mistake, the patient's life is on the line and that nurse's license is also on the line. So us working together as a team is really, really important. And guess what, team? I'm not leaving the line yet, but you all have done an amazing job. Thank you all for watching. You have completed 25 questions and I took a nap. So what I'm in all honesty, I have to take a nap in order for me to be up this late because I do so much during the day. I'm going to come back with another video. It's probably going to be maybe by 11:30, but I think that video is going to be more for my RN and or LPN students. But I'm just going to hang around. If you all have any questions in the chat, I am here to answer them. And so Kevin, Lynn, Ugochi, Georgette, Fatima, Michelle, Kevin, it's a lot of you all. Thank you all for watching. Faison, Kerlin. Yes, yes, yes. Good night, Lavina. I said that wrong. Lavini. Anyone have questions? Maya, you'll be removing to Florida. Yeah. So if you have any questions, I'm going to be on twice per week so I can try to answer your questions as you navigate and move over to Florida. I love you also, Anna Kay and Ahissa. I think I said that correctly. And Miss Nubian, you want to take phlebotomy? And Ashley has an exam on the 2nd of October. So everybody, I want to see the skills video. So the skills videos, when you go to our channel, we have a playlist. We have a multiple playlists. So you may have to, slide it over a little bit, but there's a playlist that says Prometric CNA skills videos for 2024. And I'm telling you, I need to thank somebody. Somebody sent me a cash out for $100. They didn't take the course. But what they did to pass their examination was they looked at all my videos and they wanted to know how they can buy me some coffee. They sent $100. That was a lot of coffee. So I appreciate her. And then Salem's in Texas. You're so welcome, Navette. And I'm taking a course in Florida, awaiting your background. Yes, I wish you much success, Miss Keisha, and then Duna. All right, so if you all don't have any questions, Miss Nubian, it's easy to move up to LPN. So I just did a video, I think 2 nights ago. So LPN is only 1 year. You can do anything for 1 year. So you get your CNA fast. Get in the hospital, make that money. Get your CNA license, and then they usually have tuition reimbursement. So while you're working as a CNA, you can be going to school for LPN, which is 1 year. And when you get out of LPN school and start working, the LPN to RN bridge is only 1 year. So you're going to be an RN whether you go to school straight for 2 or 3 years. Did I say straight? I said straight. I did. Straight for 2 or 3 years, or you can do it in increments. CNA, LPN, RN. At the end of the day, you're still going to be a fantastic caregiver. And don't let anyone tell you that LPNs don't have jobs. I've been a nurse now for 25 years, and I've never seen an LPN who didn't have work. They work in home care, they work in the jails, they work in the nursing homes. And now, because there's such a shortage of RNs at the bedside, we now have LPNs returning to the bedside in the hospitals. So, and that's your plan. I want the requirements to start a mobile fingerprinting business. Miss, I am blessed by the best. You got to go to our website, fltraining.com, because you're trying to get into the business now. And I'm also, do you all want me to do a business about businesses that CNAs could start? Because I'm all about going to the next level. And I know healthcare providers just make great business owners because we can multitask. Thank you, Anna Kay. All right, all right. So Miss Blessed by the Best, you want the fingerprinting business. I hope that you're in Florida because Florida is an open state. So in Florida, anybody can do fingerprints. But let's say you're in Texas, that may not be the case there. But our website is fltraining.com. It is shown on the screen. And whenever you go there, if you click on the fingerprinting tab, you'll get information about starting a fingerprinting business in the state of Florida. And if you've never gone to our website, we got all types of freebies. It's like on the second half of the page, it's going to say resources. So click on that, download you some practice tests, watch you some videos, and pass the test. And let's go for better. All right, everybody. Kevin, I'm praying for you. Good luck on your test tomorrow. Miss Dubian wants to start a cleaning business, so I will include that in the presentation I make on the best business ideas for CNAs and nurses. No, Valette, if you've not done it, are you in Florida? It's Identigo. It's where you would go at to get your level 2 background screening. And of course, I have a video on that also. It'll be how to do a level 2 for your CNA examination. But if you're in Florida, you can go to Identigo's website, and that's how you can do your background screening. Miss Nubian, I got you. All right, everybody. I need to prepare for this next video. So I'll see you in a few hours. If you're unable to stay up for the video, of course, you all can watch it tomorrow. Don't forget to like, share, and subscribe. And I'll see you all later. Good night.